the name of the presentation, Boost Your Bones. Really the important things about this bit here are the two graphics you can see. So it's quite a stark one. 1 in 2 women over 50 will experience osteoporotic fractures in their lifetime, not just straight away at 50, or it's just across your whole life. So you can see that as a high statistic. For the men, 1 in 4. So it does affect men as well, but I think women, because the estrogen connection, it makes the big difference for us, and because we tend to the average menopausal age, it's sort of 52, I think it is these days, but you know it can be before and it can be later. And for men, hormonal changes, loss of testosterone, that sort of thing, tends to hit later. So their experiences with osteoporosis hit later on for them. So they just don't tend to get as many of us over their lifetimes because it's hitting them later, but it's still relevant for them. But quite a stark diagnosis, a stark set of figures. So let's go on to the next bit. So this is what I'm aiming to talk to you about today. So we'll define what osteoporosis and osteopenia mean in case it's really new terms for you. The signs and symptoms, some may seem very obvious, but there are others that are less obvious that it just helps to be aware of. The management and prevention, I mean, this works both ways. It may be you don't think you have osteoporosis or osteopenia, or you're just not sure. Something's not happened that makes you think that you definitely have it, but you have worries about your future. Or you may know your status very directly and you want to either manage it or you want to stop it happening in the future. The loading safely with resistance bands and weights, again, this is going to be very nuanced because there are lots of reasons why that could be a challenge for you. It can be to do with holding things. It can be to do with how much to take at a time and how to change it, and knowing when to do that. And again, like I said at the beginning, this is a very nuanced sort of thing to manage. So I'll come to that later. And we're going to be working on strength for your bones and for your muscles and for balance, because these are all the components that are going to be really important for going forwards for you in trying to either manage or prevent osteoporosis and osteopenia in your future. And it's trying to do this regularly. This is one of those things that you can't just do for a little bit and then sort of leave it. It's a for life thing. That's what makes it so challenging, keeping it going for life. So moving on, osteopenia. So the basic definition of osteopenia is it's all to do with averages. When your bone density is lower than the average adult of your type, so your gender, your age, but not as low as it would be for osteoporosis. So on this journey, osteopenia is like the first part where you may get some sort of diagnosis. The density of your bones lowers with age for everybody, and we'll come back to that more later, but it's lowered to this point where it's just lower than somebody else of your age and gender. It's less severe osteopenia. This is like the earlier place to be than osteoporosis. It can be slowed down with exercise and diet. Whether it can be reversed, there are different opinions on this. And it depends what happens along the way, how you're being measured and how you'd know. We'll come to the contrast with osteoporosis in a minute. In some cases, you're going to get prescribed medication, but more commonly, it's going to be things like exercise recommendations, dietary recommendations, and things like outdoor vitamin D representations, things to do with sunshines, or taking a vitamin D supplement, or a combination of those two things. And that may have already happened for you. It's not inevitable that if you've got osteopenia, that it's going to lead to osteoporosis. That is not, it's not how it has to be. It may happen, but it's not inevitable. It doesn't always go that way. And osteoporosis can be reversed to osteopenia. You can guess now that I'm going to go to osteoporosis. You can see the logical way this is going, but you can sort of go back on yourself. So you could have osteopenia and then osteoporosis. There could be interventions of exercise, medication, diet, a mix of those things, and you might find that it goes back to osteopenia. And different things can be happening in different parts of your body, different parts of your skeleton as well. So let's move on to osteoporosis. So osteoporosis, your bone density is decreased, your bones are weaker, and you can see we've got this picture here at the bottom, and this always reminds me, if you think of chocolate bars, and I think of the high density a bit like a whisper. And if you have a whisper, it's got those tiny little spaces in it. And as we move from left to right, and you can see as we get to low density, the holes are much bigger. It's not like the first one, it'd be much more fragile if we're breaking it. I always think of like the really old fashioned aero bars, when you look at the chocolate and there's more space in between them. That's just an image that comes to mind for me. That's depends what works for you, but you can see there's more space. There is less density in that bone. It's more fragile, and they break more easily. And this can often be for people how they know they have osteoporosis, because they've had what they would be described as a minor bump or fall. Normally means from standing. You haven't sort of had a big accident where you've had a car accident or something like that. It's something where you've tripped over something, or you've just gone from being upright to downwards because you've slipped maybe on something on the floor if it's icy, and you might have had either a wrist fracture or a fracture in your top of your thigh bone. Could be a vertebrae has a fracture in it, and a fracture means the same as a break. So if someone says they've fractured something, they've broken that bone. And this condition can affect all the bones in your body. And as I've just mentioned with those different fracture sites, these are the most common fracture sites that come up for osteopenia and osteoporosis. So your spine, your wrist, and the neck of the thigh, the femur, the bone hip area. And I think, those are the ones, it's very scary. You break a bone and all the fallout of that, if you break, say, your thigh bone, the effect on your mobility is huge for a significant time whilst that recovers. If you break a wrist bone, just things that are quite day-to-day things like getting yourself dressed and brushing your hair, brushing your teeth, putting on socks, all those things suddenly become really, really complicated. So yeah, they're difficult things. So I've given you the doom first. I'm going to give you a bit of lift hopefully now. So not to panic, even with a diagnosis, or just fearing for your future, because you may think you have factors that give you a higher risk for osteopenia and osteoporosis. Things can be changed. So you can see a lovely picture of Leanne here, changing things. Diet, weight bearing, balance, muscle strengthening exercise, and avoidance of negative lifestyle factors. So these are the things you can change. So again, this is nuanced, and some things you're going to be able to change more than others because it's going to vary according to individuals. And we'll go through some of these factors as well, and you can ask questions around these. I'm sure a lot of you will have questions around these, and I'll answer whatever I can. But there are things that can be changed, and through Mobilates particularly, we hope we help change you through exercise. But we really need to look at specific weight bearing and muscle strengthening exercise that we have elements of in our class, but we don't concentrate on wholly and specifically, and that's the difference with the exercise that we're going to do here. But we do a lot of balance work, and this is because the greatest risk factor for you with osteoporosis and osteopenia and breaking bones, it's not necessarily the fragility of the bones, it's falling over, it's losing your balance. And that's the things we can really work on. And both Leanne and I add these into class so often. It's a really big part of what we do at Mobilates, and that's why we do so much standing and upright posture work, as well as the lying down work. Medication and nutritional supplementation is going to be used according to your medical team, really. It's getting into this sort of without medical help, getting into sort of nutritional supplementation and how much calcium you should take is quite complicated. Calcium supplements have their benefits, but there's issues about how they're absorbed, and there are dosage negativity. So if you go too high in your dose, it can have negative effects. So you have to take care on this. And really, it's something that you look at being recommended medically. You need a medical expert. So I can't give you, the right amount of vitamin D for you to take, or the right amount of calcium for you to take, or even if a supplement is appropriate for you. With medication, there is medication that can be given, and there's lots of different types. It does come with side effects, and I know some of you are already on this sort of thing of being prescribed something and it will work for so long, or they look at how it works and then they might change it for something else because either it's not working or because the side effects are really difficult to deal with. But there is medication and it can have big effects. So we're coming a bit to sort of explaining what is actually happening and why osteoporosis and osteopenia happens for people. So we're going into the bone cells, and this is a simplified version of what's going on, but it is the sort of main gist of it. So in your bone cells, we're going to focus on two types today. The first type are the osteoblasts, and because there's a B in there, we're thinking of Bob the Builder, just as an easy sort of memory prompt, because the osteoblasts are the bone building cells. So these are the ones that just help your bones to grow and your skeleton to renew. And in childhood particularly, the osteoblasts work really fast because children are growing, they need to. To get sort of building in your bones to stimulate the osteoblasts, there has to be stress on the bone beyond normal stuff. So beyond me just lifting my cup up and down and having a cup of tea, it's something heavier than that has to happen to stimulate those bones into something different. But that's that pull, the pull on the bone beyond a normal everyday thing is what stimulates the osteoblasts to build. And they're filling in the spaces in your existing bone tissue. So when you're very young, you have this very dense bone structure and you can't see the little holes so clearly. And as you get older, you're going to have less of this. It's not as fast. But when you hit menopause, the acceleration suddenly cranks up quite significantly. So that's the bone building part of things. Then we've got the bone cells osteoclasts. These are the opposite. And because there's a C, we've gone for another sort of sound to help remind us, Conan the Destroyer. And the graphic, not quite Conan the Destroyer, but you can think of, we've gone for a building analogy with the digger thing. I can't remember what they're called. But these are the cells that break down older and worn out bone tissue. So if you think about when you're little, you've got these osteoblasts building your body. If they build so fast and nothing is knocking them back, you're going to end up with super big bones. So there's got to be an opposite process that nibbles back at this and gets rid of the older tissue so the new tissue can kick in and sort of keeps everything in balance. As we get older, we're not building as quickly. So the first ones, the osteoblasts, are not building so quickly. And so this bone tissue being removed, there's not enough to remove, but it's still being removed. And so you start to get more holes. You're sort of losing the balance that you had when you were younger. Now, this does happen all through your life, like I said, but when you hit menopause, when you hit hormonal changes, it accelerates. So we're going to come to some warning signs for osteopenia and osteoporosis, and these may be things that you've experienced. You may have experienced more than one of these things. So a loss of height, just showing the sort of shrinking down in your structure. The posture change, so we've got kyphosis, which is rounding over from the top half of your spine. Lordosis, which is when your bum starts to stick out the other way, like a sway back, more pronounced. Your head and neck might stick forward more. So it's just leaning forward more. You might find it more difficult to straighten up. Sudden back pain, I think this is a really difficult one to isolate just for osteoporosis, but if you have sudden back pain and you're 45 and over particularly, and there's no obvious reason for it, you haven't had a sudden bump or accident, it's a factor to look at. I think a big one that comes up for many people is fracturing bones from that minor accident, like we said before. So if you're having a fall from standing. And then there may be risk factors that you have. So just having a low body weight can be a risk factor. They're not exactly sure why, but it might be just to do with how much weight is going through your skeleton as you're moving around, walking along, whatever you're doing. It's just, there might be slightly less impact. It's not clearly defined. Eating disorders definitely have an effect, particularly anorexia nervosa, but other eating disorders as well. Family history. So you may know a parent, it might be a grandparent, auntie, that sort of thing. And it may be, it's a little hard to unravel that one because it might be to do with another medical condition as we come on to. But just knowing that that pattern is there, it can be, these are all things that start to add up. Early menopause, it might be something that's just happened spontaneous for you, or you might have had to have a medically induced earlier menopause, and that's before the age of 45. Oral steroids, which I know that many of you will have had to take because they're prescribed, and they're often prescribed with things to counteract the effects. So you'd be given calcium supplements and vitamin D and things like that, but oral steroid usage, and you may have had them several times over your lifetime, or many times over your lifetime with a condition that's gone on a long time. And various medical conditions like rheumatoid arthritis, inflammatory bowel diseases. I will say for EDS, it's not clear. It's not a clearly listed diagnosis, but it's something that you do see a lot in EDS, people with EDS, and the reasons are not clear why, but again, it might be to do with not being able to load your bones as easily because it's more difficult to do that, it's more challenging. So it's not a condition that's often listed, but when you look into it, there's definitely factors that are just not clear. So coming back to exercise, the exercise that really helps us. So we're particularly looking at muscle strengthening and weight bearing. So muscle strengthening exercise to keep your muscles strong, and weight bearing with impact. And the impact bit, can be the really tricky bit to balance for everybody. So again, like we were saying before about the bone building, we're looking at adding activities in our exercise that place stress on your bones. So they're pulling at the bones, and so they're stimulating the bone building cells because that's what you're trying to do. To stimulate the osteogenic effects of bone mass, that just means to stimulate bone building. The mechanical load has got to be greater than these everyday activities, and that's the tricky thing. We often think, oh, that's probably covering it, that'll be enough, but we've got to go beyond that. So for instance, walking, and how much you can walk. Walking is a good exercise to do. It's got low impact, and it may be a really good option for you, but how much we can call it weight bearing with impact. Is it more than your everyday activity? It depends what's been going on for you. If you've been in a place where you've not been able to walk very often, that's going to be the first thing you do, and it's going to have some weight bearing impact. But actually, if you're walking quite regularly, it's not really offering you a huge amount of weight bearing with impact. So you have to build other things in. You can see we've got the references to these at the bottom. What about Pilates? Well, it's mixed with Pilates. So really the most important thing with Pilates, I think, that we give you is the balance. That's one of the key things. The muscle mass and the strength are factors, but you do have to add these in, and it depends on how you do it and what moves you're doing. Having osteoporosis doesn't mean these having fractures in your bones are inevitable. They are more likely if you've got poor balance, and they're more likely if you've got loss of muscle mass and strength, because these are going to affect your balance too. So Pilates can help with balance. It can help with muscle mass and strength, but it depends how we're addressing that. Exercise training is a promising way to deal with it, but it's really keeping it going, making it regular, and how we can do that in our lives, because that can be the biggest challenge. If you're on a boom and bust cycle, you haven't got a regular pattern that you can keep going, and it's really, we want to look at how to get out of that boom and bust. I want to be able to lift weights, or whatever your aim is, to add muscle mass and strength. So let's go into that. First, let's go into just general considerations about exercise. This is with a bias towards preventing osteoporosis and osteopenia. So an informed instructor. So we're not just talking about what you do in Mobilates, but what you might be doing, outside of Mobilates. And so an instructor who knows about osteopenia and osteoporosis. So both Leanne and I have had extra training on top of our Pilates training. Pilates training, it does cover it to a degree. It tends to give you warning things, do this, do that, and it tends to leave it at that. So you might be looking for an instructor that's had more than that. A non-competitive environment, and that's just, we don't want you to be looking at other people and thinking, well, they're doing that and I want to do that, and if you're a personality type that that tends to drive more of that, like I've just seen them twist more, I'm going to twist more. It's about being able to concentrate on what you need. And I think online classes can be extra helpful for that, because often you can't see the other people unless you're choosing a gallery view. So it can be a real advantage. Functional exercise, so being able to put in movement that you can use on a daily basis, the things that refer to things you're doing in your life, like picking up a washing basket or washing your hair or lifting, shopping, that sort of thing. An extension bias for the back. So this is working your posterior chain, working the back side of you, from the back of your head down your spine, rather than forward bending exercises, and we'll come back to why. Strength training and balance, like we've talked about before. Correct squatting and lifting techniques. This goes back to functional exercise. So if you're going to be lifting a child or a pet or just stuff around the house, good ways of doing that, especially if you've got stuff going on with your spine. High resistance and low reps. So this just means doing heavier, harder things, but not so many of them. It's really part of my task here is your journey of how to do that, because that's an easy thing to say. It's a really hard thing to achieve. A whole body approach, so that you're concentrating on not just your top half of your body, not just your bottom half, but we're getting a bit of everywhere, so all the skeleton is going to benefit. And taking care of fracture sites that you've already had. So this is, if you've fractured a rib, for instance, how you change position is going to be really important. So if you fractured a rib and that has been within the last year, how you roll over, taking time with that might be the biggest consideration, not rushing. And that sort of partly goes into the non-competitive environments of everybody else is up, why aren't I up? It's been outside of that. Right, contraindications and considerations. So these are things, what to do and what not to do. There are no absolute rules. This is the most important things. If you have always been somebody who's loved doing a forward fold and rolling down and doing your roll downs, and you've developed osteopenia or osteoporosis, and the usual guidance is to stop bending forwards. And you can see on the third one down, loaded spinal flexion, just bending forwards, letting your body hang, is not normally recommended. That's one of the general things that isn't. But if it's something you've always done and you love doing it, and you haven't got a spinal fracture or had a spinal fracture, do you have to stop? No, you don't. Would I recommend that you do a lot of them? No, I wouldn't. So in class, you've heard me mention, I'm sure, you know, if you have things going on with your back, or if you've got osteopenia or osteoporosis, and I will give you two different sorts of roll down: the standard sort, which has got the loaded spinal flexion, but the sort where we keep a straight back and you start to tuck under from the bottom and that ripple goes up your spine. If you've had a spinal fracture more recently, you have to wait at least 3 months. And you know, we always ask you for medical clearance for any fracture or any injuries that you've had that are of that level. But I needed to put it in there. Loaded spinal bending, that's side bending, so bending to the side. If you start lifting your hands up or using weights when you're side bending or going down further, that is loaded side bending. Do you stop side bending? No. But you have to take it carefully, and you're really looking at not going for your maximum, not pushing it and going to end of range. And you can see end of range on the next one, turning at the waist. So we often do like quite fluid, twisty movements. I might say swish your hands through water or slide your hands on your thighs. But I normally then say, if you've got osteoporosis or osteopenia, I don't want you to hold it there. I don't want you to keep your pelvis still and just twist your waist. I want you to move your hip. And then for the people who haven't got that, they might hold their hips still and turn at the waist. So it's really looking at pushing it further and going more to an end of range. A bit like if you're wringing out a cloth, you're wringing it right to the end. That's what we don't want to do with osteoporosis and osteopenia. Something that's highly repetitive, like a treadmill, is something that's just not a good idea. So that's not to say that running is necessarily a bad idea, but a treadmill, there's no variety in it. Each step is exactly the same, and repetition is not going to be beneficial. And at the end, one size does not fit all. It's really about the nuances, and we'll come back to that. It's also about keeping your routine going. So we're right near the end here. It's being able to keep it going, keep it up. And from the exercises that we're going to touch on today and do in the next two sessions, we're looking at things that you're going to be doing twice a week for 20 to 30 minutes. These are the strength and muscular sorts of exercises. And you don't have to do them in those big chunks. You can be breaking it up into smaller things. You might do a bit in the morning, a bit at lunchtime, a bit in the evening. But you're also looking to put breaks in. So if you're doing something twice a week, that's not one day after the other. There's got to be a gap in between. Repetitions. So in these exercises, slightly different to when we're in mobilates generally. See, I've got repetitions and sets. We're going to be doing, we'll choose an exercise like bicep curls, and we're going to do a number of repetitions, so maybe 8. And then we'll have a rest. And then we're going to do another set. That just means we repeat the same thing again and do another 8. And that's what's slightly different. You're taking it more into units that can be measured, so you can look at how to increase over time. We're also going to be putting in lots and lots of little rests in the exercises we do today. So again, if we were doing bicep curls and we did 8, and we've done 8 for each side, we put the weights down or the band down or whatever we're using. And then you have a little walk or a drink or a little wiggle, and you know we love a little wiggle. And then you'd start your set again. Then you'd have another little rest. So it's lots of little breaks. Leaving that day between, I've just mentioned that before, and changing it up. So the exercises I'm going to give you today, they will last you for so long, but there's 2 more sessions, and the sum of all these sessions is to give you a series of exercises that you can pull on and mix up, and then you've got variety going through your body, going through your bones, because you're trying to stimulate bone growth in different parts of your bones. So I'm going to stop the share, bring you all back in, and now is the time. I've kept myself on the spotlight just so you know your faces aren't popping up for the recording, because not everybody likes that. But now ask away. Oh, and there's a dog that wants to ask a question. Sorry. Liz, would you like to ask a question?
Yes, please. So if we were doing, say, circuit training at the gym,
yeah,
would you work would you break it into like a leg session and like a lower session and an upper session, or would it be okay to do all of the body in one set of circuits?
Okay, so I think that's a really good question. So you may have noticed that when we do teaching in mobile artes, that we don't tend to do a session. We might have like say a hip theme, but not every exercise is hip based. And we aren't doing 10 minutes of hip exercises. Whereas if you're in another class, I've been in ones where they're doing something and it just feels like you're doing your hips forever. And for people in mobile artes with so many difficult areas, I'm just checking off what Kate's doing. I don't like to stay on a particular area, because even if it's something you need to work, it can be really aggravating. So if you're working just your legs quite intensely for 20 minutes, you'd have to ask yourself, is that something you can personally manage? And it's a question you can only ask yourself, because responses across this group are probably going to be different. And would it be better to split it up?
Mm.
So if you think you could manage it, you could do a leg session, and then you might do an arm session on, later in the week, 2 or 3 days later. But it becomes quite hard to balance out, I think, over time. It depends how diligent you are and how much you think your body can cope with it. Can it cope with going back the next week and then doing a mixed session the next time?
Yeah, and of course you've got to factor in fatigue, because you're going to be doing it twice as long if you're doing arms and legs. And
Well,
yeah,
no, if you were doing arms and legs, I wouldn't make the session twice as long. The session stays the same length. You wouldn't be
got
doing
you.
many things. So it wouldn't be you going from a 20-minute session to a 40-minute session, because that really,
Okay.
really would be, we would be on the floor. But yeah, that's the issue, isn't it? And like the stuff, the exercises we have today, and I think we're going to run out of time and not be able to do the exercises actually today at this point. Yeah, it's a difficult balance. So I've tried in the exercise planning that I'm doing to put in something for all of your body, but I wouldn't put you into every position, because it's just too much in one session. And we're all balancing this against bodies that don't want too much. And
Thank you.
it's such a hard thing to do. But thank you. I hope that helps.
Yes, thanks.
Any other questions? I'm just going to check in the chat there. Okay.
If there isn't anybody else, I would like to ask another one.
Go on, ask a question, because you might be thinking of something that everyone else is thinking of.
I used to do a lot of weight training, and I used to really love it. So I know that I'm going to be measuring myself against my old self, and try not to do that. But when you say you've got to load more than you would for a normal activity, how much is enough and not too much? Because if you know that you've had that potential to be able to do it, and knowing how to just hold off from that.
I think
how easy does it have to be, basically, before you try to move up again?
Yeah, this is why the exercises that I've got sort of set for you in this routine, in these sessions, they are slightly different. So there isn't as much mobilizing and sort of moving the body around and getting all the joints going. There's a warm up and a cool down, but we're counting things more than I would count in class. Normally I don't do strict counting. And this is so that I would recommend doing this, that you have something that you can write things down in and keep a little record. And it depends what works for you, if it's your phone or it's a notebook. I have like a sort of planner diary thing, and I tend to scribble stuff in there. Or you can buy a pretty book just for this purpose, should you want to, because you really want to look at how many you're doing and how many you can manage. So normally in a set of reps that you do, say we're doing something like, let's go back to bicep curls. And I'm going to show you a sitting one here just for the sake of ease. So these are quite low weights for me. They are 0.75 of a kilogram. My upper body strength is not great. So for me to do that, that's pretty easy. And I know from experience that that movement particularly, I could do a heavier weight. My next ones up, although they're big, they're not that heavy. They're just over a kilogram. However, these ones, which is the next ones up in my set, I know if I do these, it's too heavy. I know I'm going to hurt just from previous experience. So those ones, not enough. These ones, they're pretty easy as well. Those ones too much. So I sort of do a mix. Either if I was going to do 8 reps, I might do 6 with these, and then for the last 2, I might get my ones that I just struggle to lift up.
Okay.
Or these, I can sort of combine holding these because they have a strap and I haven't got to wrap my hand, which is not my best. I'm not great on wrapping my hand and holding things, but I can sort of combine these together. And so they look like that in my hand. Again, this is going to vary according to how things are in your hand. The other option is things like a ankle weight or a wrist weight. So these ones, just got to find it. It's like finding the end of a piece of sellotape. So it opens out like that and you can wrap it round an ankle or a wrist. And these can be really helpful when you struggle to hold things in your hands because you can put them on like this. So if I then have these on, now that's a whole different ball game doing that. And I might even think, oh, that's going to be too much. I might swap it down to these ones again. Now I'm thinking, not just with my bicep curl, there are other exercises that I've got which involve the weight, but I know that for those other exercises, I might change the weights around. And this is a difficult thing. I can't say exactly what's going to work for you, but for instance, anything doing this, I find that hard lifting a weight, and I know that I can't manage what I can manage doing that. So having the choice is really critical, and keeping a note of what you do, because you want to, we all imagine this lovely progression that we're all going to get, and it's just this lovely line going upwards and we get stronger and the weights get heavier, but you know that it doesn't always go like that, because the next week, what if you get flu? You know, and you've been in bed for 2 or 3 weeks, and then you've got to gradually come back to class. I might be going back to, right, not these weights, not these ones. In fact, the ones that are out of shot in another box, I'm going back to those weights for a bit, and then I'm going to have to build myself up again. In the prep I've been doing for this, I've been going through the routines lots and lots of times, and I've overdone it several times. I've thought, oh, this is fine, I'm doing this is great. And then the next day I've realized I've got a migraine and I'm all achy up here, and it's not great. And that's not just some muscle soreness that goes in 2 or 3 days. It's one where I've had to wait a week to do it again. So it's, yeah, it is very challenging. I would say you need lots of options. So those were my weight options. If we talk about band options, you might have your favorite band. So this is currently my favorite band, which is not that strong. It's a red, sort of medium to soft. And then this is the one, Leanne tends to send these ones out. It's the ones I can barely stretch because I find these super strong, but I've got people in class that I know are sort of pulling these and having a great time with them. There are things I do with this, and then I'll swap over and I'll use this one. But I also have this one, which is a similar sort of strength. The colours don't always correlate, but I can also double it quite easily, and it's easier for me to hold. There's something about these sort of narrow things in the loop, because you can stand on it and have a loop rather than just ends flapping about. It gives me more options. And there's also things like these bands that come with handles. That might give you more options for holding. You can put your hand through. That's softer to hold. It's less slippy. So it's having those options. So if you haven't got more than one band, it's going to be difficult to change it up, because ultimately if you've got one band, you've got it like this, you could hold it tighter and you can double it up, but you may need more options than that. Does that help as well, Liz?
Yes, thank you. What's the difference then between lifting a weight? I thought bands were resistance and weights are like the heaviness of it. So
As far as your body's concerned, they're all resistance.
right,
I
okay.
know we tend to talk about resistant bands, but if I did an exercise, for instance, something like a deadlift, I don't want to suddenly get you all into doing this without a warm up, which is why I'm holding back on saying, everybody stand up, because we haven't warmed up at all, and I should warm you up first. But if we was going to do a deadlift, so a deadlift is like the classic, you know, when someone's got a big weight, I haven't got that sort of weight, the metal bar and the weights at either end, they bend down like that and they stand up, that sort of deadlift. So you can do that without, we do our hip hinge, we warm up like that, and then I'll do my hip hinge, see my bum going back, straight back, and I'm lifting up fresh air and standing up. So there's your first sort of, your warm up for that would be this, and then this is the movement. And if you're not used to using weights, that's where you'd start. Then you'd start with a lighter weight, but you could also do it with a band. So if I got my softer band, there's the resistance. And that can be nicer than using weights that are loose, particularly if you've got loose shoulders, you might feel safer in that sort of band. If I've got a loopy band like this one, again, you're standing on it, and you could be lifting further down like this. You can then lift your arms higher if you want to. There are options, but that one works. But you can also do the same thing with weights.
So the weights and the bands class as loading your bones.
Yes. Because they're all providing a resist, they're pulling, ultimately thinking of things that pull on your bones. Now that exercise, I know we're thinking about, we're looking at arms and hands, but when you're doing that, this is the area that you're really strengthening. We're looking at this sort of strengthening along the spine. What we haven't talked about in the exercise today, do you want to stick for sort of 10 minutes of a bit of exercise?
Yeah.
So if anyone needs to go, please go. If I just respond to Kate, the loopy one was in the email that I sent around, but I'll send you another link for that one, Kate. But it is a really helpful band. So if you will take yourself to a sitting or a standing posture, we'll get into a little bit of movement.